Hello, my name is Возкаев Изнаур Абубакарович and I first year student of the third group of the Faculty of Dentistry and I would like to tell you about artificial intelligence in the field of dentistry.
Artificial intelligence is the ability of a computer to learn, make decisions and perform actions inherent in human intelligence. In addition, AI is a science at the intersection of the mathematics, cybernetics, biology, and other disciplines. It studies methods and technologies that allow a person to write intelligent programs and teach computers to solve problems on their own. In medicine, AI was initially applied in the 20th century. The first FDA-approved medical devices using AI appeared in 2012. And in dentistry, AI devices started to appear since 2019. So why is AI needed in dentistry? It's usually used in financial services, in business, in work in engineering, in everyday life, for example, smart home, in cars such as, for example, Tesla car, for addressing purposes, in navigation, etc. In dentistry, it's applicable in radiology, orthodontics, parodontology, endodontics, etc. Let's talk about them in more detail. In radiology, has demonstrated a promising ability to detect and identify anatomical structures. For example, some were trained to recognize and mark teeth from periapical radiographs. AI demonstrated an accuracy was about 95% in the detection and identification of teeth, almost competing with the work of clinical experts whose accuracy was almost 100%. In orthodontics, was used to determine the need for tooth extraction before orthodontic treatment in patients with malocclusion. Its accuracy was about 93%. Parodontology, according to the classification of periodontal diseases of the American Academy of Periodontology in 1999. There are two clinical types of periodontitis, aggressive and chronic forms. Due to the complex pathogenesis of the disease, no clinical, microbiological, histopathological, or genetic test or combination of them can distinguish aggressive patients from patients with chronic form. Scientists used AI to distinguish between aggressive and chronic forms in patients on the basis of immunological parameters such as leukocytes, interleukins, antibody titers. The AI algorithm classified in patients with 98%, and the best overall prognosis was made using AI. The number eosinophils, neutrophils, monocytes, and the ratio of T cells as initial data. In endodontics, although the molars of the lower jaw, as a rule, have a similar configuration of root canals, there may be similar atypical variations. To minimize treatment failures associated with morphological differences and optimize the clinical results of endodontic therapy. Cone beam computed tomography has become a gold standard. However, due to high radiation dose compared of conventional radiographs, CBCT is not used systematically. Is not used systematically.
My name is Hosrov Ahmedov. Artificial intelligence has its problems.
Let's see what he's up to today.
Clinical data management and sharing are the main challenges in the implementation of artificial intelligence systems in healthcare. Personal data of patients is necessary for initial training in algorithms, as well for continuous training, validation and improvement. In addition, the development will accelerate the exchange of data between different institutions and, in some cases, across national borders. To integrate into clinical operations, systems must be adapted to protect patients' privacy, first before considering the possibility of wider distribution. Personal data should be anonymized, even with the possibility of taking with precautions. There is skepticism in the healthcare community about it. In addition, medical professionals must have a full understanding of the decisions and forecasts made by the artificial intelligence system. So significant advances are required before certain classes of algorithms, such as neural networks, can make clinical diagnosis or themselves recommendations. Although it has a lot of advantage, it is still an additional tool for dentists and specialists. Since it is not yet perfect, it can be used for more accurate analysis and diagnosis, as also to identify the degree of risk of a disease and its recurrence. It will be quite difficult to introduce into dentistry and train dentists themselves to use it. But over time, it will certainly become more simplified for training and for use. The future in healthcare cannot be ignored.